You guys got to let everybody know this message that I'm about to give you, because this is something that I just found out. It's beyond belief. This is regarding a House resolution that was initiated on May 1st of this year, like 4, 5, 6 days. Well, I don't even know what day it is right now, but it was May 1st, introduced into the U.S. Congress. It's a House Resolution 6666. That is not an exaggeration. I have no idea how this works, but this is what the actual House resolution number is: 6666.
Hello, everyone. I'm glad you joined me because I'm speak on it.
So if you haven't heard, on May 1st, the House has a bill called H.R. 6666, aka COVID-19 testing, reaching and contacting everyone. This bill, if passed, would allow for people, aka snitches, to come into your home, test you, and if you test positive for COVID, aka the manufactured infection, then quarantine you and or your children. This is a pilot program already rolling out in Ventura, California for contact tracing. Officials say will grow larger and larger, incorporating all states.
Are beginning a program today, and it's a pilot program which will certainly grow into something larger and larger, and that is a community contact tracing program. We've done contact tracing all along. That a contact is a person who's been exposed to someone that we document to have the COVID infection. When we find someone who has a COVID infection, those people are immediately isolated. But we also work with them to figure out who their contacts were. Luckily, because you have been doing such a great job of cooperating and staying indoors, staying isolated, it used to be there were 10 contacts, at least, for every patient that we would find. Now, it looks like there are probably only 2 or 3 or 4 contacts, not surprisingly, because most people have been staying away from others. And that's good news. But the purpose of this program is to bring on people. We're going to start with 10 people. We may bring on up to 50 or even more as the program grows and as we see the needs for it. As we do more testing, we will find more and more people who have COVID-19. And again, we'll isolate every one of them, and we will find every one of their contacts, and we will make sure that they stay quarantined, and we'll check in with them every day. In other words, what this program means is that we're going to do a more complete job, and we're going to do a more meticulous job of making it less and less possible for others in the county to run into someone with COVID-19 infection. It's not just our county that's bringing more people on. There are going to be thousands of people hired who will be these contact investigators throughout the state. And this is occurring in many, many other states as well, perhaps all of the states in our country. We will be giving intensive training to these people, training not only for identifying and finding contacts, but also in terms of how to be sensitive about doing it. We also realize that as we find more contacts, some of the people we find are going to have trouble being isolated. For instance, if they live in a home where there's only one bathroom and there are 3 or 4 other people living there, and those people don't have COVID infection, we're not going to be able to keep the person in that home. Every person who we're isolating, for instance, needs to have their own bathroom. And so we'll be moving people like this into other kinds of housing that we have available.
We have to wake up and start thinking, this is not okay. Why are they doing this? If we're already quarantined in our homes, and now they want to enact a bill for someone to come into the home and violate your Fourth Amendment and human rights, shouldn't we be trying to get back to normal, not enacting bills that cost billions of dollars when they barely gave the people money to survive this lockdown, which has taken away jobs and are putting people in a situation that's hard to deal with in the first place.
That I spoke about was the house-to-house and possible removal of people in Ventura County. They've updated that a little bit and said, oh, look, we're not going to be doing that, but I would suspect that they are. And an interesting side note of what's happening in California, folks, was just the other day was the introduction of Bill HR 6666. You can't make this shit up. And it's basically a bill saying, effectively, that if you're collecting welfare from the state, they're bringing in mandatory testing, and if you are collecting welfare from the state of California, if you're collecting government welfare, you will need to be subject to this mandatory COVID testing in order to receive your welfare payments. I think that's happening from June 1st. You have to be in there for testing by June 1st or something like that, or your welfare payments will be cancelled. That's a nice touch, isn't it? Put 30 million people out of work in the United States and put them all on welfare, and then tell them that if they don't get their COVID test, their welfare will be cancelled. Come and get tested, folks. Come for your COVID tests with these COVID test kits that are testing things like pawpaws and goats, and I think even inanimate objects. I think they even tried it on a glass and a bottle, and they got a positive test result for COVID-19. So come and get tested by the government-approved testing kits, and if you test positive for COVID, we may isolate you from your family. And of course, the test kits we're using, as I said, have been testing pawpaws, mangoes, goats, glasses, bottles. I believe engine oil, they even tested positive for COVID. So, you know, what a scam, folks. It's such a scam, and that's the way they're running it, and that's what they're doing to people in California, and I would think that it's probably going to come to other states as well, because that's just what they do, folks.
So let's look at what this bill is talking about. So HR 6666 is to authorize the Secretary of Health and Human Services to award grants to eligible entities to conduct diagnostic testing for COVID-19 and related activities such as contact tracing through mobile health units and, as necessary, at individual residencies and for other purposes. Also stating priority in selecting grant recipients under this section, the Secretary shall give priority to applicants proposing to conduct activities funded under this section in hotspots and medically underserved communities, stating that applicants that agree in hiring individuals to carry out activities funded under this section to hire residents of the area or community where the activities will primarily occur, with higher priority among applicants described in this paragraph given based on the percentage of individuals to be hired from such area or community. Also, the mobile health units in general, the Secretary of Health and Human Services, acting through the Director of the Center for Disease Control and Prevention, may award grants to eligible entities to conduct diagnostic testing for COVID-19 to trace and monitor the contacts of infected individuals and to support the quarantine of such contacts through mobile health units and, as necessary, testing individuals and providing individuals with services related to testing and quarantine at their residencies. And they want to do all of this asking for $100 billion. It's just absurd. This $100 billion. It's fucking crazy.
and I couldn't believe that I heard this, but basically this act is to allow individuals to come into your house, and if you've got a cough or somebody in your family has a cough, or you have a fever or anything that they determine that shows that you have COVID-19, regardless of whether you've been tested or not. They will also test people, but remember that testing already has been shown to be there to be a high rate of false positives. False positives meaning you don't have COVID-19, but the test shows it's false positive. It's showing up as positive, so they call it a false positive. We already know from the studies previously done as far back as 1984, but as recently as 2018, that individuals that did not have COVID-19 or coronavirus, even in the cat model, cats that had never been exposed to coronavirus tested positive if they had had a flu shot, if they had the trivalent or the covalent flu shot. And we don't know about the H1N1 shot. We don't know about the herpes zoster shot, the shingles shot. There's many other vaccines that people have gotten. We have no idea if people are going to be testing positive, have false positives based upon those tests. So the point is that the chance of them testing someone and them being positive is pretty doggone high, even if the person doesn't have COVID-19. But they're going to use that to pull you or your loved ones, especially your children, away under pretense of public safety. They're going to say that your child has to be removed from you because you have COVID-19, and so to protect your child, we're going to take that child, or we're going to take your grandmother or your father or you and put you into quarantine. This is a load of rubbish, because if you're in your home isolated, who are you going to expose? All right? And if they're going to try to take you away from your family, the chances of you having infected your family, even if you did really have COVID-19, is about 99.9%. So this is a bunch of BS. They're using this as an attempt to further divide us as individuals. They divided us from our friends, from our social circles. Now they're dividing us from our own family units. This is the most ominous sign so far that we've seen. I want you to all wake up.